Good morning, fellow nursing students. This presentation will quickly cover gastrointestinal drugs. GI drugs are used to treat an array of ailments like peptic ulcer disease, diarrhea, nausea, and GERD. In this presentation, we will specifically talk about histamine 2 receptor antagonists that treat peptic ulcer disease. Peptic ulcer disease is an upper GI disorder. This illustration shows an ulcer in the stomach and one in the small intestine. It can be caused by an array of factors such as H. pylori, which is an aggressive bacteria, and something as simple as mucus, which is a defensive factor. The most common symptom that patients usually have is abdominal pain. Treatment for these ulcers require a less acidic environment in the stomach so that they can heal. There are quite a few nursing implications for these types of drugs. Nurses can advise their patients to avoid things like cigarettes, aspirin, NSAIDs, and alcohol because all of these can aggravate the ulcers. And nurses should also encourage their patients to have 5 to 6 small frequent meals a day for a quicker recovery.
Drugs in the histamine 2 receptor class are used to treat peptic ulcer disorder. Histamine 2 receptor antagonists suppress 90% of gastric acid production. In this case, histamine is responsible for acid production, but the drug is preventing it from binding with the receptor, which is why it is antagonistic. This results in less acid production. These drugs are used for treating and preventing ulcers and GERD.
Cimetidine is given by mouth or IV. It cannot be given to elderly patients because it can cause confusion, disorientation, and hallucinations. The side effects for this particular drug are reduced libido and impotence. Cimetidine also increases blood levels of different medications like Coumadin. Other drugs in this class are ranitidine and famotidine. Ranitidine has fewer side effects and is slightly more potent.
Thanks for watching. We hope you learned something useful. Take it away, Professor Mack.